Hello, everyone. My name is Angelo Armandi. I'm assistant professor of gastroenterology at University of Torino, Italy, and I'm very glad to present with this video abstract on behalf of all co-authors our work that has recently published in Gut Journal. Serum ferritin levels can predict long-term outcomes in patients with metabolic dysfunction-associated steatotic liver disease. So why serum ferritin in muscle? This topic has always been fascinating to me, since in clinical setting, we can find increased serum ferritin levels up to 30% of patients with muscle in the absence of significant iron overload. According to an established background literature, this can be linked to the metabolic inflammation due to obesity and type 2 diabetes that links hyperferritinemia with significant liver fibrosis in MASLD patients. And only preliminary evidence so far achieved assessed a potential longitudinal role for hyperferritinemia associated with long-term mortality in muscle. But since no robust evidence was so far achieved, the aim of our study was to assess the longitudinal role of serum ferritin levels in a multicentric retrospective cohort of biopsy muscle D patients from 9 centers from Europe and extra Europe countries with a median follow-up of 96 months and at least 6 months follow-up visits. Starting from a number of 1,405 patients, we could extrapolate data from 1,342 patients with longitudinal events. And in particular, you can see that river-related events accounted for 7.7 of the total of the events, and that all-cause mortality occurred in 5.2% of the cases. So, what are the new findings? If we take a look at the hazard ratios of patients with high serum ferritin levels according to established cutoffs from international guidelines, 300 in males and 200 in females, we could see that patients with high serum ferritin levels had a 50% increased risk of to develop liver-related events, and that they had a risk of 27% increase to develop overall mortality at Cox regression analysis. Additionally, if we consider ferritin levels as a continuous variable in our cohorts, we could see that there was a stepwise increase with the risk to develop liver-related events starting from a value of 215.5 with positive C index value and a great concordance across the models that were tested. And similarly, we could see that there was a stepwise increase in the risk to develop overall mortality, starting from a baseline ferritin value of 272 with a good rate, I would say, concordance in the four prognostic models that were assessed and positive C index. So we can conclude here in this case that the risk to develop mortality occurred at higher levels of ferritin levels when compared to liver-related events where the risk was significant at the lower, overall lower values of ferritin values. Then we performed an additional analysis adding serum ferritin level to FIB4 score. This analysis was interesting from our view in the field of non-invasive tests. We know that FIB4 score is the most established and suggested score from European and American guidelines to stratify the risk of having significant fibrosis in patients with muscle, and preliminary evidence is suggesting also a longitudinal role for FIB4 score. And so what we did was to see if ferritin levels at the cutoff that we found for liver-related events and for overall mortality added to the highest cutoff of P4 to 0.76, the highest cutoff to rule in advanced fibrosis according to guidelines, could add to the overall predictive risk to develop either liver-related events and mortality. And this was very interesting because FIB4 alone displayed a stepwise increase in the prediction of either liver-related events and mortality. But if we add to FIT4 score the values of ferritin starting from 215.5 for liver-related events and 272 for overall mortality, the overall predicted risk was significantly increased for the two outcomes. And in our view, this could be really useful in the clinical setting. So, how might this impact on clinical practice? Our results robustly assess the longitudinal role of hyperferritinemia in MASLD patients with particular regard to the incidence of liver related events and overall mortality. And in our view, the evaluation of ferritin levels over time at baseline and follow up visits of MASLD patients would represent an easy, inexpensive, and readily available tool for risk stratification with patient on muscle. And in the end, I would like to thank all co-authors and centers that were involved in the study for their constant support, their suggestions that significantly improved the study and that carried out the whole project. Thanks to all, and thanks for watching.